Yeah, I will probably get started like with the actual webinar here in a minute. And then if people pop in, I might, just kind of pause and try to get them to actually engage. But yeah, thank you for coming. Dawn, we actually have someone all the way in England and Orlando, Florida. So what is mental strength and how do we teach it? And this is just in general mental strength. And then I'll talk a little bit about, my method and what I'm trying to do. I've learned as I've gotten older that nothing is black and white. You don't just look at the Webster dictionary and, this is the exact definition of mental strength but these are two definitions that I thought were good. Coming out of positive psychology, which has a lot of good, just by its name, positive psychology. Mental strength is that capacity of an individual to deal effectively with these things that are going on, but also, and it says here, to the best of their ability, which I would actually personally change to their maximum potential, because I think we're all performing to the best of our ability on any given day, but we might not be functioning as well as we could, if we had better tools to do that. And the regular Wikipedia, just that resilience and confidence. I think confidence does have a lot to do with mental strength. We see this definitely in the patient population. And when I say patient population, I'm talking about people who are seeking mental health treatment because they, have symptoms, right? We see a lack of confidence, like, no, I don't have any mental strength. So I do think confidence has something to do with that mental strength also. So I just wanted to kind of get, a general idea. We have, two professionals here, as far as mental health professionals, but how would you describe mental strength, or if you were talking to someone else, or even personally, how you've developed that mental strength?
Thank you. I believe it has to do with your experience and what you have gone through and have succeeded in the past in areas of either loss or disappointment, or just unfair situations that you've gone through, and that you or maybe something that you've had a miracle in the past that you have gotten through because of the tools you have in your tool belt, and then you go on and you're able to really have success in the future because you've gotten through it in the past.
So resilience, basically, like your ability to take those things.
My definition of mentally strong, was that the question?
Yeah, or mental strength, or just, how you would define that.
Okay. Boy, I think it has so many facets to it. It's almost hard to narrow down, but it's tools that you've learned over time to deal with the things that come at you just in normal daily life. And when crises, come along, which they happen to all of us, how you build on those tools to make it through those really tough times.
Absolutely. And, I love that you said it's complex. There's really not a definition. It can, just even where you are in your life, all of the things that are going on.
For me, it's probably find the right balance to be able to cope with everything in life, work and family and duties and before I thought I had a good balance. I was able to cope with everything. I felt good, and even when I didn't feel good, I worked through my mental strength and trying to
Mhm.
come back to the surface. At the
Mhm.
moment, it's a bit.
Well, one of the things that, one of the books that I read about mental strength was The Man's Search for Meaning by Viktor Frankl.
Yeah.
And it's kind of a, it's an intense book. You have to be, willing to take that time. It's not an easy read. But the premise of the whole story, and this is a psychiatrist by trade, Jewish psychiatrist by trade, who was being used as a medical doctor in the concentration camps of World War II. And he talked about the constitution of a person, like that there were people that just were stronger and that made it through out of pure will. And I think that I love that point. But what I think has happened in our culture is that we think that that's innate or genetic or personality, and we don't actually teach mental strength. And so what I feel like my mission is to help teach mental strength. And because we can learn to be mentally strong. Does it decrease the pain of losing a child? No, it doesn't decrease that pain. But it helps us be able to live. I mean, just live and live and find happy moments. I mean, I think my grandfather had a saying, which I laugh about now as I've gotten older, but I think is actually a negative thought process of, when you're young, you think you have the world by the ASS, right? Like you think you've got it. And then when you're old, the world has you. And I think we get to this age, where things just have happened and we're just like, it's, where is that? Where is that mental strength? But, also where is that happiness? How do I use strength to find happiness and purpose and those kinds of things? So that's what mental strength is to me. It's like this, it's an actual journey, get through things throughout your life and you're on this journey. But what I want to start doing is actually teaching how to be more effective or efficient in that process and not feel lost. So how do we teach mental strength? I would love to start getting it to children, like teaching mental strength. Not me personally, my business plan is to teach adults who are working with children how to teach mental strength. And how do we teach mental strength to adults experiencing symptoms? And that's what we do here. I do run a clinic with about 4,000 patients. We have about 120 people coming through here a day. This is med management and counseling. And the counseling is around this premise that we can teach mental strength. But this is a difficult population because ours happens to be a difficult population because we're doing a lot of chronic mental health and stuff of this, this is who I am. I'm depressed, I'm anxious, and they're owning it rather than identifying it as what they struggle with. And if you ask a lot of people who are experiencing symptoms like depression and anxiety, are you mentally strong? They would probably say no, like they're connecting it. And so we're teaching mental strength here in the clinic. But then also in prevention, and that's, kind of the YouTube and what I'm trying to do here and with the classes of like, we can actually learn to do these things before we get symptoms. Like, I'm trying to get it out, to people like you and I that, teaching mental strength or just understanding what you need to do for that should be in everybody's journey of mental strength. So when I think about children, or I'm talking about children, I've created this growth wheel, and this is not for children to look at. This would be if I were teaching an adult how to work with children and what you should be working on with children. This is what I would use. I also just yesterday had my whole staff in and did an activity where we looked at the growth wheel and we evaluated ourselves, right? So, you know, did you get all of these things as you were growing up to get that strong foundation? And it was actually very profound to be able to see the difficulties that people have had, and they've found their mental strength, right? But they were like, wow, if I knew this back when I was 12, I would have been able to make better choices, or I would have, you know, felt better about these things, or these negative thoughts wouldn't have been, you know, constantly, you know, and still in my mind as an adult. So this is, it would take me 2 hours to actually explain this little cute picture. So I just kind of put it in here. This is a very lay person's visual presentation of developmental psychology, right? So the middle circle is, you know, genetics, what you're born with. You're you might be predisposed to depression or anxiety or bipolar. And then, you know, that next circle around it is like, you know, that 0 to 5 years old. Were you in an environment where you felt safe and trusted and loved? The next is like 5 to 7 years old. You know, did you learn to identify your emotions? Did you have an environment where you could communicate with your parents? Were you learning to know yourself? And, you know, then it goes out as they get older. So if I were talking to a parent of an 8-year-old, you know, I would kind of show this and say, these are the things that we should be talking to our children about and beginning to teach them about these things in these different age groups, so that that outer circle is somewhere in early adolescence. In a very healthy person, kid, they would start working on those things. But when we were doing this activity with my staff and on myself, there's so many areas that I didn't get when I was a child. I never liked myself, right? And I'm coming up on my 50th birthday here in about 6 weeks. And I'm like, I've done enough self-work that I know myself now. I think I like myself, but loving myself, you know, is still difficult. And, you know, and that is a lifetime journey because things change and life. And all of these outer circles are a lifetime journey of that mental strength and how we keep growing. But being able to recognize where those things have, you know, the things in your past have affected, you know, why you can't, you know, you're having trouble loving yourself, or why you're having trouble with self-control. So this is when we're teaching children this, we can also retrospectively teach ourselves with that activity of kind of going back and did I get these things that I need? Because we, you know, everyone's talking about, oh, self-love, but, you know, what were the foundational things that didn't get there to be able to do that? And then we teach children the actual, a modified version of the mentally strong method, which teaches them to think, organize, and choose. And so being able to teach kids as young as 5, you know, how to start thinking through and organizing their thoughts and making choices. There's a lot of like a social emotional curriculum out there, you know, doing like, you know, helping identify, process emotions, insight, coping skills. But really this is on a bigger scale of really trying to teach that how to think, organize, and choose. So, you know, mental strength starts in childhood. And so obviously when there's trauma and those kinds of things, there's difficulties in resilience, and, you know, you could even have symptoms, but ideally we could start teaching mental strength in children, because we yeah, we want to say we have mental strength, but then it takes something big to happen to realize, oh, maybe I don't have the foundational things that I need. You know, teaching to mental strength, teaching to adults experiencing symptoms. So, you know, if someone is telling me, especially in this online environment, you know, experiencing depression, anxiety, you know, when do you seek mental, you know, actual professional help? You're not going to just go to one of my classes and think that your depression is going to go away. Way more complex than that, right? But the number one thing in does a symptom need professional help is, do you want to harm yourself or someone else? The answer is 100% yes. You need professional help, right? You need to go and get an evaluation, talk to somebody, not just a counselor, someone that does like a medical evaluation. But I think most of us are on this like continuum. We know we're not at that max potential, right? But and we're not functioning. Like if you're not functioning, if you're not getting out of bed, if you're not going to work, that's not functioning, probably need professional help. But in the middle there, that 1 to 9, do I need professional help? I remember my life started to fall apart in 2005 when Johnny died in a drowning accident, and that was one of my adopted children. And then my girls started to rebel, and then Reggie was diagnosed with DRPLA. Yeah, maybe I could have benefited from going to counseling, but I did not have time. You know, I wasn't at my max potential, but I was functioning and I was getting through every day, and I wasn't, you know, I wasn't necessarily taking care of myself, but I wasn't hurting myself, right? So I was, you know, right there in the middle, in the midst of everything. And that's when I developed the mentally strong method. Like, how do you actually get to your max potential in when all of these things are going on? And I've always been a proponent of cognitive behavioral therapy. And so that's what I basically just started doing on myself. And so the mentally strong method really can be broken down into 3 words, but I think some of us have been doing this for years without a formal like formula to do it, right? You know, can you think through what's going on, and can you make sense of it? And this is what happens when you lose a child. You can't make sense of that. That's not natural. It was not ever in your thought process. And so, you know, all of a sudden you can't think through it, and it creates all of these other problems. And the grief by itself, it's hard to grieve because you're thinking negative thoughts. I can tell you for myself, you know, what didn't I do? What could I have done? I'm not a good mother. You know, all of these negative thoughts. And that's where your thinking goes rather than being able to actually grieve. And so that's why it's important to organize the thought processes, because you're right, there is absolutely nothing that can take away the pain of losing a child or any loss. Like you can't take away that pain, but what happens is we're trying to think through it and process it. It's actually getting into other areas of our life that we don't realize that it's getting into. And so when I talk about mental strength, I'm talking about the ability to think through the problems, organize them, and make choices in line with what you want. And sometimes when things like that happen, what you want completely changes. You know, what do you do with that? And then the grief seeps in, and all of the pain gets wrapped up into it. So the mentally strong method helps do that. And there's 4 elements to it. And this little picture here on the side, you know, your personal vision is kind of over everything. When I say, what do you want? You know, what do you want out of your retirement? What do you want with your life after losing your child? And when we're depressed, we're like, nothing. I don't want nothing. I just want it, you know, like, I just want the pain to end. The pain's not going to end. So we have to figure out a personal vision. And then the thought map, identify and organize are kind of under that personal vision. So sometimes when we're working through the mentally strong method, we actually start with the personal vision so that we can, you might have to dig deep to find what do I want? I don't know, because I had completely other plans. And so when you're thinking through your problems, I think that's something that we do a lot of, but we don't actually organize them. But when I was in the midst of needing, I remember when, you know, I called my mom one time, you know, this was 15 years ago. I call her, I'm crying. All of these things are happening. You know, the girls are rebelling. Reggie's, you know, I'm exhausted. And she's like, and of course she says I should go to a therapist. And I'm like, I don't have time. She's like, well, why don't you journal? And I'm like, oh, well, one, I don't think in complete sentences, but journaling is a great way to get those thoughts out on paper, right? For me, journaling is too much, like to have, you know, it would take me forever to get out all of the thinking and feeling that I needed to get out. And what happens is we use a lot of time and energy thinking, and it could even get to ruminating, which is a negative form of thinking, in that we're not moving forward because we're spending a lot of time thinking. And so, but we have to think about it. And so this is a way to get it out on paper, right? We get it out on paper, and it really started out with a blank piece of paper, and I would just put anger in the middle, and then I would write everything that made me angry again. Over time, I've developed this process to actually include, you know, things that have made you angry in the past, things that have, how this affects your spiritual relationship. And we get all of that information, which would have taken me days to write in a journal. We get it out in 20 minutes. Like, these are all the things that are going on in my head right now. I don't need a complete sentence to know what these words mean. And so it allows to think in an organized way. And so that's how we teach thinking. But I'd like to hear how other people kind of think through and process some of the things that they go through.
One of the things that, since my husband has passed away, I've had to learn, like you were saying, how to get up and get dressed and go on my walks and do the things I know to do, even though I don't necessarily want to do them. And so very similar to your chart, I was introduced to a process of putting 3 dots on one side and 3 dots on the other, and putting down 3 things that you got accomplished that day that you feel good about, even if it was going on a walk or getting up and putting your makeup on or whatever, and then writing 3 things that you are grateful for on the other side. And so for me, looking back, I see that even though I'm not where I want to be, I see that I have progressed and have gotten mentally stronger. I haven't reached that joy or happiness quite yet, but I can see that I have been progressing. And I see with your chart here how that would help you identify what was going on today. And then how you could look at it later on and realize how much you've grown.
Absolutely. This just kind of helps confine that and not let you get into that rumination where you're just, you know, woe is me, this, because you could spend hours. And, you know, I love the way you said the choices, you know, like you make choices. And one of the things that I often talk about is that professional counselors are doing a great job of helping people think through things, this first element, right? And they have all these skills that they are teaching. But the perception or the person that's receiving that often thinks they're doing talk therapy. I just went in and talked to my therapist for an hour. Well, what did you learn? What did you get out of it? You know, what choices are you making moving forward? And sometimes, especially, I felt like, you know, after losing Reggie, it was with my catalyst to like, I have to teach this, is that we have to help people organize, because oftentimes we, you know, I'll say to someone, you know, or you'll read a self-development book, or you'll be following someone and they'll be like, oh, just think positive, and positive things will happen. And this, well, there's some truth to positive psychology, because if you can change those negative thoughts, you are going to find the gratitude, you are going to find happiness. There is, but it's not, the way it's being taught is like magical thinking. Like if you just think these things, they're going to happen. And when horrible things happen and you have to process them differently, you can't just read a self-help book. You have to put these things in different categories. And so grief is its own category. And and so that people can do that map and they can pull in, okay, I lost a child, and that is obviously grief. But what are the negative thoughts going on in your head right now? Because those we can change. We can't change the fact that you lost your daughter, can't change the fact that you lost your husband. And so you have to find time to feel that pain. But the negative thoughts, we can work on that. Like that is a choice-based thing, right? So, you know, and then like behaviors and choices, I see this often. I'll give an example of like someone who has had trauma. So many people who have had sexual trauma, especially in adolescence and childhood, actually sexually can become very promiscuous, and then have, you know, make personally bad choices to use drugs and those kinds of things. But we can still put those in choices, right? Because the trauma was not their fault. And yes, it led to those choices, but to take the power away from themselves, that those were choices. So you can see how if we can separate these in your mind, that the choices that you make, they can be in the right categories, right? So tell us a bit about the 3-dot activity.
What they were saying, just like you, when you're so much in the first area of grief, you don't have the energy to, you have to take care of life and your children and meals, and you don't have time to read a self-help book from cover to cover. You don't have the energy to do that. You don't have the energy to journal, even though I'm a professional that teaches journaling and I typically journal. I didn't have the energy to journal.
That's energy is a good.
It's not only the mental energy to do it, it's actually the physical energy to do it. And so when I heard this philosophy of, you know, just do 3 things, and 3 things like, you know, getting up and getting dressed, or taking a shower, or making sure you've eaten, or making sure you hydrate, or making sure you breathe, do some breathing exercises, because you forget to breathe when you're in grief. Just little things. And then as time goes on, you know, it's paying the electric bill and figuring out which bank your money is in, and going and, you know, going to an attorney. So you can look back and go, well, at the beginning, I could just put my shoes on and go for a walk, and I was finished for the day. And now I'm able to do things that are more constructive for my future. But then I
Mhm.
do come home and collapse and still don't have
Yep.
the energy to journal.
Yeah. Well, and what's, so the grief is causing the fatigue or the, like, I just can't do it, the depression, the grief. But doing those things actually help give you energy or move you in that process. But that's behaviors and choices, because the choice to lay in bed and feed into that fatigue is also a choice, right? So this is
True.
where we're able to help them identify, no, doing your little 3 things is not going to take away the pain, but feeding into that fatigue is also a choice. And so, putting that in the choices category to empower people, like, you have this choice, but you're still going to have to feel that pain of the grief. And so when we talk about these different categories, we talk about them directly in relation to your ability to make a choice, right? So if, I'm going to go backwards. If we talk about triggers, so when we talk about the power of choice, I help people like make choices, specific to this category. So, like I was talking about before with the grief and the negative thought of being a bad mother, I could have done something, that then, anxiety and worry, like, what's next? If this could happen to me, what else could happen to me? And, unfortunately, like in my case, Reggie and Maya both had this rare neurodegenerative condition, and Reggie had been sick for, sick meaning like he wasn't communicating, he was G-tube fed, he was in and out of the ICU. And so there was always this fear that he was going to die. Maya's presentation of the DRPLA was, she had seizures, but they were controlled by medication. She had some developmental delay, but she went to like a college program for special needs adults. And so it was like night and day. I mean, I thought for sure, even though this was progressive, that she would live at least 10 more years. Like the shock of when there was no expectation. I almost feel like sometimes God made sure I felt all the different types, because I've also am currently experiencing anticipatory grief because my husband has the same disorder, right? Yeah. Like I literally have felt every type of grief. And, but a lot of those things go into other areas. So for me, I had never experienced trauma, never been physically or sexually abused. But the day I found my daughter, is traumatic. And and that's not the grief, because I'm not going to give all the details to make, but, but it was traumatic. And, I'm having flashbacks of that. And so that actually needs to be in a different category, right? Because the grief is the pain of losing her. But how that happened was very traumatic. And so when I make choices so I talk about this thing called controlled grief. And, I just kind of coined it myself, because I take specific time. And I say, this is my grief time, right? I'm going to bring out pictures of Maya. I'm going to watch videos, and I'm literally just going to cry of the loss. No, I'm not going to think about the day that was traumatic, right? Because that's trauma. And I'm going to really use that time to grieve. And I experienced this with Reggie, and I know eventually I will experience this with Maya, but it's only been 7 months. So still going through this, but the more you can take the time to grieve, the less often you have to do it, and then the less intense it is. It will never not make me cry, right? It never will. But I think what happens is we think moving on or living means that we have to go on, and that we're not allowed to break down and cry. And so we're kind of stuffing it. And then something will happen that's a trigger, right? Which is a different category because we can't control our triggers, right? Because my kids had a rare disorder, I was in a community of mothers who had special needs children, and another child recently passed. And that is a trigger, right? That triggers my grief, my story. And, you know, but I don't have control of that. So if that happens and you haven't organized, you haven't taken that time to grieve, oftentimes you just break down at most inappropriate times. But if we can have more organization to that and, you know, say, okay, I feel it coming up, I'm going to have to take that time to grieve. And sometimes, you know, I used to say, you know, like put a time limit on it. And now I have been like, that actually doesn't work. And if you do it in the morning, you're doing it all day because, so I usually try to schedule those things in the evening. And so you can see how if we schedule them when it's a good time for us, maybe it won't come up when we're triggered. Maybe it will. I mean, I'm not saying being triggered and, you know, kind of it coming up and crying at it, you know, an inappropriate time is wrong. I'm saying the more often we do the controlled grief, the less intense that is. But we will have to do that forever. Like it, you know, you had a significant loss. And, you know, for me, spiritual conflict is a whole nother category, right? God allowed this to happen to me again. And like, how is this God, a loving God, if this is the life that I have to endure? So, but keeping that separate from grief, right? Like, so that it doesn't, because if you look at this picture, the one on, I hope it's your left, where it's like all squiggly lines, that becomes our brain. Like all of those things, all of those emotions, the fact that it's an injustice, the fact that, you know, this causes a spiritual conflict. I'm angry at God. I'm, you know, I could have made better choices. I'm triggered by this. All of that just gets like a squiggly spaghetti and nothing makes sense. But what happens on the opposite side of that continuum, if you look at those boxes that are all neatly organized, right? This is theoretically a man's brain, right? Like everything is compartmentalized, nothing is touching. I don't think that's gender specific. I do think that there are people that just can compartmentalize. But I often see that someone who has used being able to compartmentalize to function their entire life, when something big happens, they immediately go to that squiggly brain.
Yes.
And what I'm saying is neither is healthy, right? We should be working on our mental strength and how to organize things that happen before something big happens, preferably. But, you know, even after, like, you know, let's get through and organize these things so that, you know, which is the last element, is that we can make a personal vision. And this is not about goals, like not, you know, career goals and those kinds of things. This is about like, who do you want to be? Do you want to, you know, I personally want a relationship with God, but it's a struggle right now. Like, so, you know, I have a personal vision to really try to connect authentically with God. So, coming up with those personal visions so that instead of just saying, for me, I want a relationship with God, but clearly he doesn't love me and I'm not going to deal with it. Or stay in that anger. I'm going to make a personal vision. And right now I'm just going to pray, meditate, and try to receive. Like that's all I can do is try to receive, right? So that's where I am. But making that, like an actual personal vision. What is my physical goal? For me, if I'm not physically active and healthy and doing something, even before all of this loss, I would experience depression. I always tell people I was depressed before I had a reason to be depressed. So there's, I have to make physical goals. Like I want to do this and make a physical goal. What are your, mental, emotional goals? Would you like to be able to confidently say, I am mentally strong? And so, if that is your goal, what do you need to do? What are the action steps that you need to do to get there? And then what are also the barriers? Because the barrier could be, I can't get out of bed, I'm so depressed, right? And so let's just come up with 3 things, or, so, being able to identify those barriers so that those can be addressed and they can be put back into, one of those categories so that you can make choices to move forward. So it doesn't take away the pain. The pain still has to be felt, but it can make it where the pain doesn't take away your happiness. I always say happiness is a series of moments. It's not a constant state of being. Nobody's authentically happy 100% of the time, right? And so if we could grab one happy moment and say, oh, I had that moment. I laughed, with my sister this afternoon, right? And it might have been literally 30 seconds, but you can hold on to that as a choice. Like I'm going to find my happy moments. And so, your personal vision can be about, I'm going to find those happy moments and move in that direction. So that is the formal presentation as far as, mental strength and how I teach it. But I think that, many people figure it out. I think but it's kind of taught as, mental strength is an attribute that we respect in people and we admire in people, but we don't teach it anywhere. So it's like that sink or swim mentality. Like, can you survive? And, where we could be teaching it and empowering people to be able to do that.